Rush is a busy place. Sometimes our jobs are hectic, and when we're in a time crunch, it's tempting to do things too quickly. Rushing through a process, taking shortcuts, using workarounds, or multitasking can lead to mistakes. Mistakes that impact our patients and us. Speaking up about an error is not just the right thing to do, it is something we can all learn from, as our colleagues explain.
The patient was 81 years old. This lady had had a history of breast cancer. She had had a stroke. She was having pain in her hip and her leg. And in order to help to alleviate the pain and produce a better quality of life, we do nerve root injections. And these are injections of an anesthetic into a covering around the nerve, and it stops a lot of the irritation and it stops the pain.
I am the fellow, so I am the one who consents the patients. I have explained the risks, such as infection or bleeding, and the patient and the family agreed with the procedure.
And she was prepped and draped, and we did a timeout. And so we magnified the image, what allowed us to see the detail better. And then we had to magnify it again. I was having a difficult time localizing the area under fluoroscopy because of the patient's demineralization and degenerative changes involving her spine. The detail was obscure. So what I decided to do, because we were having problems, is I actually called in one of my associates. He came up and I explained the case to him. He said, okay, he'll come in and help because this was a difficult case. So we did the procedure. We made the injection. We actually talked to the patient afterwards. She said she was free of pain.
So I started looking back the images that we have taken during the procedure, and I checked back with the prior imaging of the patient. I realized we did the injection at the wrong spot, and I felt terrible. Then I went to Dr. Bird immediately. Then we came to my workstation and we looked at the images together. And she also agreed with that, and we immediately went upstairs to speak with the patient.
After we talked to the family and they understood, then I went back to the reading area and I made it a point to call the referring physicians to let them know what had happened and that we took full responsibility.
And we participated in that meeting to explain step by step what happened during the procedure. We all explained our roles, and we have all discussed on some decisions, how to make it better next time.
One of the things that came out of the root cause analysis was that we should do a second time out. It's very important to make certain that you have the right location. You know, I'm the chair, I had my pager on, people were paging me and talking to me during the procedure about other things. Also, I was covering another service. The whole key was I was distracted.
As we are all medical professionals, what we have been taught on the first day of medical school is primum non nocere, do not harm the patient. So it's always patient care.
There was a mistake that was made. And the key to all of this is that it really doesn't matter who you are. The most important thing is patient care.
Following our policies and procedures matters. We all play a role in safe care for every patient, with every employee, every time.
Good morning, Mr. Andrews. How are you today?